Assessing the impact of COVID-19 on African economies. Historically, pandemics have economic impacts that last far longer than the virus itself. 100 years after the bubonic plague of 1348-1350, for example, Europe's population was still smaller than it was before the plague. This devastating impact had significant economic consequences for those who survived, creating labor shortages, higher wages, and the rise of Europe's middle class. Before we continue, please don't forget to like the video and subscribe to the channel. The flu pandemic of 1918 infected 30% of the world's population, killing between 3% and 6% of all people worldwide. In the United States, states that suffered larger numbers of flu cases also benefited from higher wage increases. However, children born during the 1918 pandemic were found to have lower education attainment, higher rates of physical disability, and lower incomes when compared to cohorts not born at this time. In the case of COVID-19 in Africa, the long-term economic repercussions are unknown. COVID-19's economic impact is to be expected to continue far longer than the virus itself. The COVID-19 pandemic, which has infected 10% of the global population, is expected to have long-term economic consequences in terms of income, debt, food security, health, poverty, and education. While vaccinations offer a ray of hope for global health, they will not undo the economic damage that COVID-19 and comparable lockdowns have inflicted on countries. COVID-19's economic implications are particularly obvious in the poorest countries, where the pandemic has already exacerbated pre-existing economic weaknesses. Understanding COVID-19 in Africa requires an understanding of its diverse impacts. The number of infections per million population in early December 2020 ranged from as low as 8 in Tanzania to as high as 19,673 in Cape Verde, a difference of 2,500-fold. South Africa, with the largest number of COVID-19 cases on the continent, is reporting more than 13,000 cases per million population. Chad and Niger have fewer than 110 cases per million population, while just to the north, Libya and Tunisia report more than 8,000 cases per million population. How countries are affected economically are in part related to how they are affected epidemiologically. The economic susceptibility of African countries, on the other hand, cannot be predicted purely based on the number of COVID-19 infections reported. Although some severely poor African countries, such as Burkina Faso, have not experienced a huge number of COVID-19 cases, they are nonetheless suffering severe economic implications as a result of the virus. Other African countries, such as Tanzania, have tried to avoid the impact of COVID-19 by simply not reporting on cases, a solution which is not likely to be sustainable. It's vital to comprehend how COVID-19's impact is influenced by variances in economic structures. For example, Cape Verde, Africa's most extensively infected country in terms of per capita infection, gets 18% of its GDP from tourism, which has been ravaged by COVID-19. In Kenya, shipments of fresh flowers declined by 80% as the demand from European countries vanished due to Europe's COVID-related recession. On the other hand, African countries that are large producers of minerals such as gold have suffered much smaller impacts, due in part to the rising price of gold. Macroeconomy. The African Union divides the economic impact of COVID-19 into exogenous effects and endogenous effects. The exogenous effects are related to declines in trade between continents, reduced foreign direct investment, reductions in official development assistance, declines in remittances, etc. Endogenous effects, on the other hand, are directly related to the economic consequences of COVID-19's expansion in Africa, such as worker illness and mortality, as well as the effects of lockdowns that restrict access to local trade. The World Bank predicted that the world economy would rise by 2.5% in 2020. That forecast was shifted to -5.2% by June 2020. Tourist-dependent economies in Africa were expected to be struck particularly hard, notably the Seychelles, which was expected to grow at 3.3% but is now expected to shrink by 14.4%. The reduction in oil prices, from $67 per barrel to $30 per barrel between December 2019 and March 2020, hurt countries that rely on oil exports. South Sudan's economy, which depends on oil for 90% of its exports, was expected to increase by 10.3% in 2020, but is now expected to shrink by 4.3%. With the release of a vaccine and the termination of lockdowns, these losses will not be reversed immediately. According to McKinsey, the global loss of tourism income could be $8.1 trillion, with revenues not rebounding to 2019 levels until 2024. According to a study conducted by the United Nations Conference on Trade and Development, COVID-19 will reduce merchandise exports in Africa by 17%. These, and many other macroeconomic shocks, will have long-term economic effects for most African countries. Debt. Increases in COVID-related deficits and debt can be attributed to a number of variables, including lower tax receipts and greater spending on fiscal and monetary policies aimed at mitigating the pandemic's economic impact. Several nations, like Eritrea, 189%, Cape Verde, 124%, and Mozambique, had significant debt-to-GDP ratios prior to the epidemic, 104%. According to estimates, the pandemic will cost Africa an additional $500 billion as a result of the epidemic, leading to more borrowing and debt. The goal of multilateral debt relief efforts, such as a debt moratorium, was to free up resources for healthcare. Attempts like these, however, have largely failed. Only 4 of the 25 African countries eligible for such aid applied. Concerns about existing debt being downgraded and perhaps precipitating private sector debt default are among the grounds for such opposition to debt relief. Loans from the International Monetary Fund (IMF) have helped South Africa. They'll cost around $4.2 billion and will have to be paid back 40 months after the initial distribution. The IMF is expected to provide Nigeria with $3.4 billion in funding, while Ghana is expected to receive $1.0 billion. IMF support for African countries is expected to total $16 billion in total. Food insecurity is a serious problem. A total of 135 million people were expected to be food insecure in 2019. This number is expected to nearly treble to 265 million by 2020, thanks to the spread of COVID-19. By the end of 2020, Oxfam expects that 12,000 more people would die of hunger every day. Food poverty and hunger have increased as a result of the expansion of COVID-19 for a variety of reasons, including a lack of access to agricultural inputs, such as seeds and fertilizer, limitations on imports and exports, and an inability to move products to domestic markets due to lockdowns that restricted domestic trade. As farmers have been unable to sell agricultural products, the farmers' purchasing power has declined, resulting in further food insecurity and starvation. Health. COVID-19 has a number of health consequences in African countries, primarily because people are unable or unwilling to receive needed health treatments. For example, a 3-month suspension of tuberculosis services followed by a gradual 10-month recovery would result in 24,700 extra tuberculosis cases and 12,500 tuberculosis deaths over the next 5 years, according to a research in Kenya. According to a study on the influence of COVID-19 on malaria cases, the number of cases could climb by 36% in high-burden African countries, resulting in an additional 20,000 to 100,000 malaria deaths. Another HIV treatment study found that, if COVID-19 disrupts treatment, it could result in an additional 500,000 HIV deaths in Africa. According to another study, a 3-month lockdown might prevent 2 million more women from using contemporary contraception and result in an additional 15 million incidences of gender-based violence. Poverty. COVID-19, according to the World Bank, has the potential to push up to 150 million people into extreme poverty by 2021. Changes in income influence a substantial part of economic success for many African families. Is a family's income higher or lower than the prior year? Since the beginning of the pandemic, this question has been asked in telephone surveys of households in numerous African nations. The findings appear to show significant income losses. In Kenya, for example, only 3% of respondents said they were earning more this year than they were the year before the outbreak, 2019, while 42% said they were earning less. Only 5% of Nigerians said they were earning more than a year ago, while 48% said they were earning less. In Kenya, 36% of families said they had missed at least one meal in the preceding 7 days, while in Nigeria, 61% said they had missed a meal. These figures are concerning because they show that already poor households in these nations are experiencing negative consequences that are pushing them deeper into poverty. Education. COVID-19 has resulted in the closure of 99% of schools and other learning venues in low- and middle-income nations. While school closures have a direct impact on children and their capacity to learn, they also have an influence on children's nutrition, parents' ability to work, and the protection from gender-based violence that being in school affords, particularly for girls and young women. COVID-19 may also cause public resources to be diverted away from education to support other essential needs, such as healthcare and economic stimulus. This loss of human capital is particularly concerning from an economic standpoint as it can impede people's ability to work, make money, and pass on human capital to future generations. Distance learning may be a partial solution, but it is not a long-term solution in poorer communities where young people do not have access to a computer or the internet. Developing a multi-sectoral response. Treatment and prevention must be the first steps in any response to Africa's pandemic. African countries will be able to begin the process of economic recovery faster if they can obtain affordable and effective vaccines. Health programs, on the other hand, cannot solely focus on COVID-19, they must also address other health issues that have been impacted by COVID-19, such as access to family planning and reproductive health services, maternal and child health services, and malaria, tuberculosis, and HIV prevention and treatment. As a result, health system improvement must be prioritized not just as a health measure, but also to mitigate COVID-19's economic consequences. COVID-19 prevention, including access to COVID-19 vaccines and treatment programs, while essential, will not fully address the long-term economic consequences of COVID-19 in Africa. Responding to the economic impact must begin by defining the impact in each country. As already indicated, the epidemiological impact across the continent varies significantly, but the economic impact may be even more heterogeneous. Some countries, for example, have not incurred significant economic impacts because the price of their exports have risen, e.g., gold prices have risen significantly since the start of the pandemic. Other countries rely on sectors that have been much more negatively affected by COVID-19, e.g., countries, such as South Africa, that rely heavily on tourism, have already incurred a large economic impact due to the pandemic. Africa's reaction must also address debt-related challenges. The World Bank and the IMF are working to offer poor countries debt service suspension. Debt is likely to climb, especially in countries that have experienced both huge outbreaks and harsh lockdowns, e.g., South Africa. Additional IMF loans will almost certainly be required in other African countries, potentially worsening the existing debt problem. Given the massive debts that many donor countries have accumulated, it may be particularly difficult to expect these countries to provide additional debt relief. As a result, a strong multilateral response to debt is essential. Food insecurity must be addressed as part of any response to Africa's economic crisis. Africa must be ready to manage food insecurity from both a supply and demand perspective as it faces its first recession in 25 years. Food supply have been severely harmed as a result of restrictions on movement both within and across national borders. Food insecurity can only be alleviated by keeping trade open. The movement of commodities and services, on the other hand, must be done in a way that keeps people secure and reduces health risks for those who trade.